common issue many patients have after an ACL reconstruction is loss of extension, or more so hyperextension. We have many doctors and many PTs that convince their patient that they need to go and do prone hangs. Nick, let's have you go into the prone position. I'm not a big fan of the prone hang for many reasons. As you can see, he's very vulnerable with his leg hanging off the table. Also, you get the influence of the hamstrings trying to basically protect the joint from going into extension. So you get hamstring spasm, hamstring pain, especially if they've had a hamstring autograft. Also, you can see the pelvic influence and the low back influence. They're going to tighten up low back, pelvis is going to become rotated and become malpositioned. He's going to fight this position the whole time. It's not a very forgiving position for patients to try to regain hyperextension. I prefer a supine, low, long duration stretch. So Nick, let's have you go in the supine position. And all I do is I put something underneath their ankle and prop them up. I need space under the calf to maintain that ability to get hyperextension. And then I place a weight just superior to the patella. I think that's key. We don't want to do we don't want to do any damage to the patellofemoral joint or wear it away specifically. So we put the weight above the knee joint, above the patellofemoral joint, and we just maintain that position. I usually recommend 15 minutes, 4 times a day if I see that they're beginning to lose range of motion. I also like to include heat over the knee joint and maybe even some continuous ultrasound along the joint capsule. That can help also to get a deep heat to the tissue, which can help to get the knee to get into more degrees of hyperextension. So I think it's critical that you consider supine, low, long duration versus the prone hangs to make sure you can get your hyperextension that's equal to the contralateral side. That's the key. Numerous research studies have shown that you'll see in the PowerPoint presentations, that symmetrical hyperextension is the key to functional outcomes.